Okay, how to reduce your chances of getting a heart attack by 97%. Okay, let me just tell you that it is possible, and it's documented in the medical literature. And the way to do that is not to do it alone, is not to go online and figure out how you can do this, that, or the other to improve your chances of not having a heart attack, although that can help. But to achieve that, you need a doctor. What kind of doctor? You need a concierge medicine doctor. You need a doctor who believes in prevention, in being proactive instead of reactive. Reactive means they handle the condition after the fact, after it occurs. Proactive is they do everything they can to do early detection of the condition and or to look at markers that indicate that the likelihood of that condition is getting higher and higher and higher, so they can do something about it before it actually occurs. Advanced medicine could be used by concierge medicine doctors because they have time for it. They only see about 500 to 600 patients instead of 5,000 to 6,000 patients. They have time for you. They spend time, they get to know you, and they get to really look at different ways to test your body using advanced medicine, like testing your genes, the genome, testing the bacteria in your gut microbiome, testing your the calcium deposits on your big arteries, which are all indicative of conditions that you may be developing as we speak, or you will be developing soon. And do an advanced medical test, blood tests, to also look for markers of disease. Okay, so they have the time for this. They look at this, and stats show that good primary care physicians that have a concierge practice can save the lives of their patients by preventing a heart attack 97% of the time, by lessening the potential for developing pneumonia, which can kill you if you're older, by 91%, by reducing your chances of congestive heart failure by over 90% and so forth, or over 80%, I would say, and by lessening your need to go to a hospital for any reason by over 90%, okay? So it's worth it. You have to have a doctor for that. Look for concierge medical doctors, look for those who are highly qualified. And another little tip, when you choose one of these doctors, see if they're willing to treat you like Amazon does, as a client, as someone who has the power of decision to click and leave the clinic, to look at the qualifications of the doctor, look at the patient ratings of the doctor, just like you're buying a commodity, you're buying a product, who treat you like a very valuable commodity, who share your medical records with you, who are there to help you, who ideally give you an app so you can track your steps and track your sleep and track your blood pressure and track so many other things that you should be tracking in addition to your weight and body composition and food and hydration and all of those things, and who looks at these records for you and who can call you in real time when things are indicative of a potential danger to you. All of that coming together in the practice of concierge medicine and the partnership that the doctor has with you as a paying client, because up till now, doctors were never paid for value delivered. This is not how medicine operates. And they don't get penalized when the value drops, most of the time. You know, we have disciplinary actions going on every now and then, but very minimal, negligible. If a doctor puts himself or herself up for evaluation by the patient, respecting the patient, allowing the patient communication, on equal footing with the doctor. The doctor is just an expert in the area of health. You may be an expert in many other areas. So you're equal to your doctor. Okay? If the doctor has that kind of mentality and spends time with you and has this kind of practice, then that's the right doctor for you. Okay? Find a doctor like this. Hopefully you'll find one close to you and join their practice. Thank you. Hi, this is Dr. Matar again. If you like the video, please give it a like and subscribe so you can get the future videos. If you're new to the channel, what I do here is I discuss cases of my most successful patients who struggled with diet and exercise, yet were able to achieve at the end of their programs a well, fit, and slim life. I want the same for you, so if you have any questions or comments, please send them my way. I'd love to hear from you. Thank you.